How many of you believe that your organizations are experts in the science of behavior change? We have one. Any others? All right. If you are not an expert, if you do not have experts in behavior change, there is no hope for you. Right? Half of all healthcare costs are associated with bad behaviors. The clinical behaviors that have to change in order to address the problems we have will only be addressed through behavior change. Behavior change is a science, and it's a science that has to be embedded into digital tools. Google, Apple, Amazon, all those organizations are experts at behavior change. Look at how many devices they get you to buy. Look at how many apps they get you to buy. You have to become experts in behavior change, and it's a science. And if you haven't hired people to do that, you need to go home and do it. Walgreens has stepped up and said, we are going to be experts in behavior change. They have professionals that consult with them. They have employees that are focused on this, and they have their different programs that incorporate education, devices. They now have over 800,000 consumers that use their balanced reward programs. Over a quarter of those have a physical device like an Apple Watch or a Fitbit or whatnot connected to the platform. You get points for good behavior like walking or running or exercising or doing your blood pressure or standing on a weight scale or whatever it might be. Those points translate into coupons. Those coupons can be redeemed at their store for anything that you want. And I tell this to some people, they say, well, what if that same consumer goes and does that with CVS? Who cares, right? You are trying to say, we are on your side as a consumer. We're on your side for healthy behavior. We're going to reward you for good behavior. We're going to incentivize you. What they find is 40% of the people are tracking their activities on a regular basis. 17% have lost over 10 pounds. And those people that track their behavior the most have the best behaviors. Because what happens is wearing an Apple Watch, wearing a Fitbit is actually a leading indicator of who's most engaged in their health. And people that are more engaged in their health, guess what? They have better health behaviors. And so what they've done is they've used gamification, gaming mechanics, gaming principles in order to get people to change their behaviors towards healthy behaviors. And they're now moving this into chronic disease management and other areas. So what I've done is I've taken a lot of the different theories and ideas around behavior change, and I've created my own version of behavior change models that I use in the different consulting work that I do. And what I do is I focus on, first of all, what are we trying to guide people towards? What sort of healthy behaviors? And so there's 7 different domains of health. And what you find is that the healthiest people have a balance among these 7 domains. There's physical health, social health, intellectual, spiritual, financial, environmental, and emotional health. Some places and some people have greater needs of one versus the other. I was recently in Korea doing a workshop with a big insurance company. They're a life insurance company that wants to get into digital health. So we focused on what are the problems that Koreans suffer from and should be the primary focus of a digital health solution in Korea. All of the people in the workshop immediately gravitated towards one thing: emotional health. Why? Korea has 3.5 times higher suicide rates than the OECD average. They are the most stressed out country in the world. So for them, emotional health was the primary area of focus, and so we're looking at digital health interventions and solutions around emotional health. You then have to take what you're going to guide people towards from a health perspective and figure out how you enable that. And the way we enable that is increasingly looking like games that are really good at enabling people to do things, all right? And so you have narratives like the Mexican soap opera narrative that you heard yesterday. You tailor it to people's specific needs. You have feedback loops that give a lot of information to people so they know how they're doing. You change their fundamental beliefs and their values about whether or not they can achieve this. You include behavioral economics, so you actually help people do things that you don't expect them to do, and we can get into that some other time. And then you apply other sorts of gaming mechanics like levels and rewards and whatnot. You then motivate them. And we almost always jump to financial rewards as a motivation, but the reality is most of us do most of the things in life not for financial rewards, but for more emotional rewards. It's the area of positive psychology. It's the science of happiness. And so we have to look at the 5 elements that really define the science of happiness and positive psychology and have those be the rewards that really drive people's positive behaviors. And then within that guiding, enabling, and motivating, what we then do is provide technologies that support it, and there's certain elements of those technologies that really drive it. And then we provide education that, again, supports it. But education and the technology really have to be invisible. One of the great things that I liked about Michael's example of the Mexican soap opera is that people really weren't aware they were being educated. The education was almost invisible. The same thing has to be true of technology. As we think about these digital health solutions, the technology needs to be as invisible as possible so that we eliminate as much friction as possible.